All right, perfect. So yes, I'm going to be talking all about the MD program. What are the requirements? What is med school like? What's it like as a student? And hopefully I'll answer all the questions through the presentation. But as Vincent said, at the end, I'll try and answer as many questions as I can. Also, I do apologize ahead of time. I'm kind of fighting a cold that I had a few weeks ago, so I might be clearing my throat every now and then. All right, so we'll start off with the territory acknowledgement. So the U of A and Edmonton is on Treaty 6, 7, and 8 territory, as well as the homeland of the Métis. So we just want to acknowledge the sovereignty, the tradition, and the histories of these First Peoples of Canada, which includes the First Nations, Métis, and Inuit nations. All right, so without further ado, this is everything you need to know about the MD program at the U of A, but you were maybe too afraid to ask or you didn't know who to ask. So actually, to start off this presentation, I'm going to be talking about what isn't a medical doctor because I feel like there's a bit of confusion in terms of who's a doctor, who's not, who's an MD, who's a PharmD. And this slide here, you can see that these are all different health professionals, but they're not part of the MD program. They're not medical doctors. So I can point out one, like something like a pharmacist. We do have a pharmacy program at the U of A, and you may have gone to their presentation. I think it was last week. You can get a PharmD, but that is separate from the MD program. Something like dentistry as well. You can get your doctor of dental surgery. So you are a doctor in that sense, but you're not a medical doctor. It's a separate program. And the last one I'll mention is optometrist. That's an eye doctor, and that is a OD, which is Doctor of Optometry. And unfortunately, we don't have that at the U of A, but you can take a look at this list and or take a picture if you'd like. These are different specialties. They're not part of the MD program, but that doesn't mean, you should just take that out of your list of potential careers. These are definitely good careers as well. But we're not here to talk about these professions. We are here to talk about MDs. And what's kind of interesting about MDs is that it's quite broad. There's not just, you're not just like a general doctor. You do specialize in some field or another. So something you might see, family doctors, general practitioners. I'm sure most of you have seen a general practitioner at least once in your life. But then you have things like a pediatrician, which focuses on kids. You have dermatologists, which focus on skin, emergency physicians. So those are the ones that work in emergency rooms. Ophthalmologist is your eye specialist. You have some professions that are less focused on like person-to-person patient care. So something like a radiologist or a pathologist, they'd be looking at scans and slides and tests. And then on the right side here, we have our surgeons. So neurosurgeon, general surgeon, plastic surgeons. There's kind of this divide in for doctors. There's like the medicine side and the surgeon side. So that is kind of a distinction that you might want to think about because if you're a surgeon, you really work with your hands a lot. Whereas something like a family doctor, you'll still work with your hands, but a lot less in terms of doing procedures or surgeries on people. But if you get an MD, you can be anything within this list. So this is the Faculty of Medicine and Dentistry. So the MD program is just one part of it. So we share our buildings with things like dentistry or pharmacy. Yeah, we might share a few buildings with pharmacy. So it's multiple buildings, tons of staff. It's really a big school, as the U of A is a big university. So this is medical school. Most of our classes, at least right now, are in the Cates Center for Pharmacy and Health Research. We have 660 medical students across 4 years. And in terms of faculty, there are tons of faculty, 700 full-time and 2,200 community clinical faculty. And here at the U of A, this isn't true for all universities, but for us, the MD program is 4 years. And once you complete those 4 years, you get your MD degree, your doctorate. So here's a slide about equity, inclusion, and diversity. So the U of A is trying to incorporate these values into their medical school. So the IMDSA, the Indigenous Medical Dental Student Association, it's kind of like they kind of represent that group for Indigenous students for our medical school, as well as the BMSA, the Black Medical Students Association. So there is some work towards the diversity. So these organizations, if you do get into medical school, and if you're part of these groups, you can definitely take a look at them because, yeah, they're trying to advocate for your rights. All right, so we kind of did a brief overview of what a doctor is and kind of what the U of A is like. But this is probably the part you really want to pay attention to because, if you're convinced that you want to be a doctor, well, you have to apply first. And we're going to split it into academic and non-academic requirements. So academic requirements. Number one, you do need a bachelor's degree. And again, some medical schools, you actually don't need a degree to get in first. But at the U of A, by the time you enter medical school, you need to finish some bachelor's degree. So something like if you study at NAIT, they don't offer like a bachelor's degree. You have to go to somewhere like the U of A, for example. Now, this is also another thing that people don't, I guess, realize usually is that you don't actually need like a bio degree, a physiology degree, a neuroscience degree. It could actually be in any specialty. So, something you could do like engineering, you could do arts, business. There's probably more. I can't think of any more, but of course you can do science as well. But the point is that it can be any specialty. Don't feel like you have to study biology. There's people in my class. We have one guy who's a lawyer, and he practiced, I don't know for how long, maybe like 5 years, and then he got into medical school. So not everyone has like a bio or a science background. Not only that, there are no required prerequisite courses, which I'm pretty sure is different for dentistry, because I think dentistry, you have to take certain courses. But actually for medicine, you don't have to take any specific course. So if you want to take all geology courses or you want to take all business, all math, that's okay. The medical school doesn't look at the specific courses you take. What they will look at is your CGPA, which is like your cumulative GPA. And that number, it's on a 4.0 scale for those who aren't studying at the U of A yet. It's at a 4.0 scale. And the minimum is 3.3 for Alberta residents and 3.5 for out of province. So remember, that's a minimum, and this is like a competitive metric. So just because you hit the minimum doesn't mean you can just like celebrate and be like, oh, I don't have to get any higher. Of course, the higher GPA typically looks better on an application. Another thing is the MCAT. So the MCAT is the medical college admission test. And I believe most, if not all medical schools in Canada require you to take this. And it's a pretty long exam. It's about 8 hours long. It's divided into 4 sections, which I think I have here. Yes. So each section is out of 120, I want to say 128. It might be 132. It's been a while since I took it. But the point is that you're given a number score for each section. And for U of A, all you need is a 124 per section. 124 per section for Alberta residents. If you're out of province, there's a slight increase in requirement where you have to get 128 in the CARS section. CARS is like your reading comprehension section, which is typically the hardest. So the MCAT requirement is a little bit different. It's called a threshold requirement. So once you hit that 124, it doesn't really matter if you have like a 127, a 128, so on and so forth. As long as you hit that 124, like that's all you need. And that's actually quite nice. I believe we may be the only med school in Canada that does this kind of threshold requirement for the MCAT. So just something to keep in mind. Oh yeah, there you go. Once you reach that threshold, again, you're good, at least for U of A. So I'm sure a lot of you, or at least some of you, will look at that and think, okay, well, I gotta do good on my MCAT. I need to get a really high GPA. And to some extent, that's true, but actually a lot of your application also has to do with non-academic requirements. So you will have a section where you can fill out your personal activities. So that's things like work experience, volunteer experience, leadership, and life experiences. And actually a fun fact, if you wanted to kind of start your application now, like without actually formally paying the money, the U of A website, which I'll show you later, it'll break down like, okay, this is what we're going to ask you. And this is how many characters you have to respond to that question. So yeah, you could even start thinking about what you're going to put on your application now if you just go on the website. But yes, this is kind of the different categories for the personal activities and personal highlights. So yeah, it's not just, how do I put this? It's not just like your typical you have to volunteer somewhere at an official organization. The life experience and personal highlights section can be quite broad. So like if it's like a trip you did, or if you like, let's say you work on a farm and you want to talk about that, maybe if you experience some hardships in life, maybe you're a refugee, you can talk about that in your med school application. It doesn't just have to be volunteering at a hospital. Which, by the way, I never volunteered at a hospital and I got into med school. So don't feel like that's actually a prerequisite because you don't have to. So other than personal activities, references are another thing. And I believe U of A asks for two. So you want someone who can vouch for you. Casper test, if you are interested in actually a lot of different programs, not just medicine, you'll probably have to take a Casper test, which is like a situational judgment test. It's done online just through your computer. I think it takes about an hour or so, hour and a half. And it's kind of like a situational ethics judgment test. And you do have to take that once per year because it's only good for one cycle. And then, if you submit all that, your MCAT score, your personal activities, references, Casper test, then you will move on to the interview, which is the final phase. And for this year, it is going to be online. I'm assuming for further years, it's always going to be online. However, U of C, their medical school just switched back to in person. So I can't say for sure that U of A will continue being online, but at least since 2020 and including this year, it is online. So medical school, applying to medical school is actually quite expensive. You have the application fee, you have the fee to take the MCAT, which I think is like $500, $600. The Casper costs money. A lot of things cost a lot. So we do have this thing called MD Aid. You can actually see their email down here on the bottom. So we do have a program to kind of help people, those who are in financial need or have barriers to access things like MCAT prep, interview prep, medical student mentorship. We do have MD Aid. So if you are interested, again, the website and their social media is down below, or you can Google search it and they can support you. All right, and this is specific to high school students. I think this presentation is for people of any background from high school to university. But if you are in high school and you want to do a medical student education camp, you can sign this QR code here. It's kind of like it's going to give you experience, kind of exposure to things like physical exams, anatomy, physiology, kind of like giving you a little sneak peek on what medicine could be like. So if you're interested in the summer 2024 camp, you can sign that QR code below. So that was a lot of information. How far are we now? We are about 15 minutes in. So if that was a lot of information, here's a little timeline. We started with you need a bachelor's degree of any kind. You're gonna put in some personal activities. You're gonna write your MCAT, and I believe you can check the website, but I believe October 1st, 2018 is the last accepted MCAT date for this cycle right now that we're currently in. So I believe for you guys, if you're applying for next year's cycle in 2025, I believe that'll be 2019. But definitely double check the website. Application is due October 4th. It's usually due in the beginning of October. I don't think it's the same day every year, but it's always like the first Friday of October. Casper test, as I said, situational judgment. Interviews are every March. I think it's usually like the second or third weekend of March. If you get accepted, we send out acceptance letters in May, although it can stagger, like you could be put on the wait list. I think there's one person in our class that got accepted, who got put off the wait list and accepted like 2 weeks before school started. So some people get in pretty last minute. And then if you begin, you will begin the last week of August. So usually like August 28th, August 27th. That is a timeline. Applicants to the MD program. So what's nice about Alberta is that 85% of our positions are for Alberta residents only. Plus, if you're rural, we actually have some seats saved for you, 30 positions. Also, those who are Indigenous, there's also like an alternate selection process. So if you meet the admission requirements, you'll be recommended for admission. There's also a Black applicant admissions process, which I encourage for anyone in that population. You can look at the MD website to find out more information. Oh yes, there's also a medical military training program. Not too familiar with it, but again, I believe there's a special selection for them as well. Oh, actually before. So yeah, there are, I believe about 182 to 185 people being accepted this year, and I'm pretty sure the number will slowly grow for the next few years. And 180-ish, that's pretty typical for a medical school. So research, so medicine and research kind of go hand in hand. We do have these additional programs if you want to be a part of it. So something like an MD PhD program, MD MBA, there's a STIR. I've actually never heard of this one before, but kind of just gives you a different or more opportunities to do research. Summer students research program. I had a few friends do this between first and second year in the summer. So if you are interested in research, we're definitely looking for clinician scientists. So there are some programs that may interest you. This is a picture. I think this is an old picture, but this is a white coat ceremony. So if you, actually, let me put this to the side. I don't know if you guys can see that. Let me put that here. All right. So white coat ceremony. Yeah. If you get accepted, you get your own white coat. It's kind of like your physician's coat. I have mine. I think it's in my closet right now. And it's like this huge ceremony. You like swear this vow to never do harm and always try your best. So that's usually like a huge occasion. You like invite your whole family down. All right, so we talked about requirements. Now let's move on to what Ashley Medical School is like. Let's see what you're actually signing up for. So it's kind of med school again, it's 4 years. It's split into two kind of sections. So the first 2 years are called pre-clerkship. And this is kind of, closer to what high school and university classes are like. So it's a lot of lectures. You'll do some labs, some small group work, you'll shadow some physicians. So you're really trying to get the foundations down. And in fact, that's the first block or the first course is called Foundations of Medicine. And then from there, you go through all the body systems. So endocrine, cardiovascular, pulmonary, renal. I'm currently in the cardiovascular system. And once you finish year one, you just keep going. You keep going into GI, reproduction, so on and so forth, psychiatry, oncology. So really, yeah, you're just trying to get like the foundations. Now, throughout the 4 years, but especially in the first 2 years, we have these like longitudinal themes. So they're kind of trying to teach you these concepts that aren't as easy to teach through lecture. So we may have different speakers come in. We have different like volunteering things that are part of our degree. So that's where we learn about things like patient safety, communication, physical exam skills. Those are things you learn throughout all 4 years, but definitely a lot in the first two. Then 3 and 4, you spend less time in the classroom and you are in the hospitals and you do your rotations. So I believe a lot of health science degrees are like this, where third and fourth year, you spend more time in the clinic. That's where you're going to learn your practical skills. And you can see here, that's where you learn the specialties that I showed you earlier, surgery, family medicine, psychiatry. You're going to rotate through all of them. And if you're wondering, like, can I just do psychiatry for all of year 3 and year 4? You can't. You have to rotate because they want you to get like a diverse experience. They don't want you to just, do surgery for 2 years straight. You can do that in residency. Another thing that's kind of longitudinal is electives. So these are kind of like options, but they're not like electives in high school where they're like a whole semester or a whole year long. These are things that could even be just like 3 weeks long or like 10 hours long. I think I have an elective that's called global health, and I think it's only 20 hours. So it's like once a month type thing. So those are also supposed to help supplement your education and hopefully like help you decide what you want to do. And some of these electives are international or remote. So I think some people can go to like Europe. You can go to like the Arctic. It's kind of just to give you a different perspective on things. Student supports. So the faculty really wants you to succeed. And I think that's one thing I do appreciate about medicine. I can't speak for all faculties and all programs, but once you're in medical school, you have to understand that the school has invested in you and the province has invested in you. So, like, if you fail, that's actually more of a failure on them than you because they want you to succeed, right? Like, we have a doctor shortage. If one med student flunks out, that's actually a huge impact. So, they have these like different checkpoints in place to make sure that you'll be able to continue with your education. So if you fail, they're not just going to kick you out immediately. They're going to meet up with you, find out what they can do, find if there's any accommodations, and then set you back on your path. So after 4 years of medical school, you will graduate with a doctor of medicine, which is great. However, that doesn't mean you can just start practicing because now you must do residency. Residency is like extra training into your specific specialty. And that's where we saw like that slide from before, the psychiatry, family medicine, surgery. That's when you do your residency. And for some, like family medicine, it's only 2 years. But for others, like pediatrics, surgery, psychiatry, it could be 5+ years. And you do get paid, but I think it's around like 60, 70, 80 grand per year, which might sound like a lot right now, but I'm pretty sure for the amount of hours you put in, it's not that much. It's enough to help you survive, but definitely not close to a physician's salary. Here is a summary slide again. This one's a bit more broad. So you do need to finish high school. And not only that, you do need to do an undergraduate degree. And in the brackets, we put 4 years, but it could be 5, could even be 6. And then you apply to medical school. And if you get in, it's 4 years. And then residency, again, 2 to 5+ years, depending on what you decide to specialize in. And then finally, after all that, you can become a practicing physician. Now, I will say that this timeline is like the ideal timeline. Actually, maybe not even ideal. This is like the quickest timeline you could probably do if you want to do medical school. So the average age, which I don't know if they took it down, but it was around 25 to 26 years old. That's like the entrance age on average. And if you graduate from high school at 18, finish your undergrad degree at 22, well, that means you're 3 years younger than the average. And that's because a lot of people, especially people in my class or just the past few years, a lot of them have work experience or they've done a master's, they've done like an after degree. Really, like medicine, they're finding that people who have more experience end up being better physicians. Not to say that if you're younger that you won't be, but there's definitely this trend towards older applicants. And you can look at the admission statistics. I think they took it down for a bit because there was an error, but overall, like the average person does not get in right after graduating from their bachelor's degree. That is more of a uncommonality. That's more rare. Usually people will have a master's or work experience under their belt. And what time are we at? Almost a half an hour. And I think, yes. So the last thing in my presentation, so I guess I kind of lied. I didn't say absolutely everything you want to know about medicine. I kind of did a general overview. If you go to this website, which I put at the top, ualberta.ca/medicine/ so on and so forth. You could also just Google search U of A apply to medicine. You will get this page. And this page will probably answer, I want to say 95% of your questions. Yeah, probably 95%. In terms of like hard criteria things, everything is here. If you want to find out about like transcripts, GPA, MCAT, everything there you have before you apply. So like the requirements, apply now, the FAQs, most things are in this page. So yeah, I do encourage you to check this out. I mean, you kind of have no choice. You really need to check this out if you are serious about applying. But thankfully, I think they made the website pretty nice because, yeah, it answers a lot of your questions. Cool. So it's 5:29. So yeah, usually I do this presentation in 40 minutes, and then I get like half an hour worth of questions. So I was trying to go through it a bit faster. That way we had more time for questions. And if we go through all the questions, I can also talk about my experience through med. So at this point, I think I will start answering some questions in case anybody had any. And I can see 7 Q&As lined up. We have an anonymous attendee. What specialties would you recommend? If you mean in terms of like doctor, I don't know. That really depends on what you enjoy. I myself am probably looking towards family medicine because it's quicker. And like when you're an older applicant, I'm 25, so I'm not that old, but definitely like, if you're getting older and you want like a family, you want to get married, doing a residency that's 5+ years may not be in the cards. So it really depends on what you like. Next one, do you think that in the future, U of A will lower the education requirement? Like instead of a mandatory 4-year undergrad, you could get in earlier? Yes and no. So I think yes, they may lower the education requirement because what they're finding is that, peer academics is not a good indicator that you'll be a good doctor. It's really about, and even I kind of agree with that. I think your personal experiences speak a lot more about how you're going to be a physician rather than your grades. So yeah, they may lower the education requirement in terms of, let's say, the GPA requirement. Will they say like you don't need an undergrad degree? I want to say probably not, because again, they value people who have lots of life experience. But again, that's up to the faculty. Can you tell me what non-academic activities that I have done? So I I did a lot of student groups when I was in university. Of course, once I graduated from those student groups. I did, what did I do? I have a YouTube channel, which is pretty cool. So I did that for a while. I did Breck Brothers, Big Sisters for a while. Um, I did some traveling. I did something called Vida, which is like you get to go to like Guatemala and you like volunteer at a pop-up clinic there. So I found that very useful. What else did I do? I kind of just did stuff that I enjoyed. I played volleyball, if that counts too. So yeah, I actually did not do many like medicine focused stuff, but I did things that I think would make me a good doctor. So like I work at the library, for example, and I knew that the library, you're dealing with a diverse population and you really need good people skills for that. So that is applicable to medicine, probably more than just like being a door person at the stollery. Not to say that that's a bad volunteering thing. Does U of A drop your lowest year? Yes, I believe so. I don't think they won't drop your most recent year, but I believe they can drop your other years. But again, I would check the website because yeah, there's some terms and conditions, but yes, there is a possibility that they'll drop your lowest year in terms of like GPA calculation.
I can actually jump in on this one really quickly for you, Jason, in terms of
Oh,
admission requirements.
yes.
For the GPA requirement that Jason previously touched upon in his presentation, the CGPA of a 3.3, this is calculated from your most recent 60 credits that have been completed. Credits being the university translation of what a course is. At the University of Alberta, each course is 3 credits, right? And then, so that'd be your last 20 courses or the last 2 years of full time schooling. So that is how the U of A GPA calculation does for medicine.
Cool. Thank you, Vincent, because yeah, that definitely changed from when I applied. So thank you for correcting that. And again, as a reminder, for anything like nitty gritty, I would check the website. I can only give you a broad overview or just my experience. As a high school student, do I need volunteer hours and internship hours, or can I have one without the other? So do you need volunteer hours? I would say yes, because there's a section for volunteering. And if you leave it blank, that probably doesn't look very good, just being honest here. So it's not like you absolutely must, but if you go through 4 years of undergrad and you do no volunteering, that's probably not a great sign. Internship, I'm not sure what you mean by that. Um, if you do like a job internship, you can definitely put that on your application, but it's not required. So leave it at that. Again, check the U of A website. It will tell you exactly what they want on the application. Next question, since there isn't a preferred bachelor's program and prerequisite to get into this program, can you do your undergrad in a program like entails? 100% yes. Yes. So let me think about people in my class. We have some nurses. They did a full nursing degree. We have a few engineers, and we have that lost lawyer guy. So lots of diversity. Where can we look at the stats? So it's on the website. I'll just put it that way because I think they may have taken it out. From what I heard, I think there was just like an error that they put in it. So they just like had to basically take it down and then they had to take it down and they're gonna put it up eventually. It'll be like a table that shows you like the like average MCAT, average GPA, average whatever, average age, it will be there. It might not be there right now because I don't see it on the website. Do you need do you need physics or math to become a doctor? No. So yeah, you don't. Although I'm in cardiology block and we're dealing with graphs. So if you've never seen a graph before, I guess that kind of sucks. But again, it's not required. Other specific qualities or experiences the admissions committee values in applicants? Uh, Not specifically. Yeah, not specifically. I think it's pretty cool. Like I talked to the people in my class and I would say overall it's like pretty diverse. So yeah, maybe genuine. I'll say genuine qualities and genuine experiences will probably get you in. Oh, undergrad specialties. So I think someone's asking like, is there an undergrad specialty I should do? I would do which one you like the most. Oh yeah, because here's like a side note. I would still do a degree that you can enjoy and maybe find a job in because I don't think you should, me personally, I don't think you should chase a degree just to get into med because the reality is that a lot of people don't get in, or a lot of people take 3 or 4 or 5 tries. So, in terms of an undergrad specialty, you should look at, I mean, not gonna lie, physiology, like I'm learning. You saw the slides, like you learn about the body systems in medicine. So if you really have no clue what to do, you could try physiology, but otherwise I would still choose something that you enjoy. Does the U of A offer problem-based learning in the MD program? Maybe. I'm not sure exactly what problem-based learning is. We do have like these small group sessions where they present cases and then we have to discuss on like what do we think the diagnosis is, like what tests should we run, um, what treatment should we do? So if that's problem-based learning, then yes. Otherwise, I'm not too sure. Next question, is it necessary to take all 3 sciences AP in high school? Will the IB program help? So no, you don't have to take any science courses at all in high school. And you don't have to take any science courses in university either. Did I? I did. Did it help? Yes, because the MCAT, the medical college admissions test, it tests you on biology, chemistry, physics, along with like psychology, sociology, and a few other things. So yeah, I will say like if you didn't take any science at all in high school and university, the MCAT may be a bit tricky because they're gonna test you on like organic chemistry, like molecules. They'll test you on basic biology, basic physics, like velocity equals distance over time. So not necessary, but it just makes it a bit more tricky. Will the IB program help? To be honest, I took IB. I did not study for the IB exams. I just did it because my friends were in it. So I can't really tell if the IB program helps. Maybe. Next question, is there a requirement to do at least one full year course load during undergrad? Oof. Vincent, do you know the answer to this by any chance?
I do actually. So
Nice.
this is actually very dependent upon what faculty you are studying with. For instance, if you're studying with a faculty of arts, there is not a requirement for you to take a full course load, right? You can take it at your own pace. However, some faculties do require students to have a complete course load. The most recent example I can think of the top of my head is that for, let's say, the Alberta School of Business, you must have at least 2 years where you have a full course load, right? So it depends on what faculty you're going into, depends on what requirements they state. It's kind of more of a question once you're entering into that faculty that you can answer.
Cool. Thank you, Vincent. We work well as a team, especially for the academic stuff. What did I take as my bachelor's? I did a biological sciences major and a physical sciences minor. And it took me 5 years to finish because I don't know how to read a degree planning sheet properly. So yeah, I know I advise some people to not just like choose a degree out of a whim, but that's kind of what I did. Um, do I regret it? I mean, looking back, I probably should have done something more focused and really chosen something I was passionate about. So maybe something like computing science or business. So that is what I took. Does program delivery and assessment follow universal? Whoa, this is a does program delivery and assessment follow universal design for learning, educational framework, or more traditional teaching and assessment styles? That's a mouthful. I want to say I'm really not sure how to answer that question. In terms of the program so far, I would say like it's a mix of like really you do have to sometimes sit down and just listen to a lecture. That's what I had to do all day today, pretty much. But there is some small group work. There's like a fair amount. I'd say like 40% is small group work. Um, and definitely like you shouldn't get out of medicine just like the sitting down lecture part. You probably learn the least amount probably when you're just sitting down and lecture. Next question, with the winter term being omitted, does the U of A just count from your most recent term and count backwards till you hit 60 credits? And again, I might have to ask Vincent for some backup here.
Sure thing. So when we're discussing winter term emissions, this is I'm presuming you're referring to the time where the COVID-19 pandemic had caused us to cause a year to become a pass fail year. What this would mean is that generally you would go back until you have 60 credits of graded coursework. However, unless another completely random and spontaneous event occurs that causes this wouldn't happen. I am seeing that for a lot of individuals that are asking about the cumulative GPA, things about courses. Please do note that this is going to be something that you can ask the admissions team on the website that Jason was talking about earlier. This is information that'll be on that website that Jason was discussing. So maybe not the most appropriate area for to ask for Jason, as he's a student, right, not part of the admissions board, but things for you to all keep in mind.
Cool. Thanks, Vincent. I think, yeah, I'll skip over like the academic stuff for now. And then if we have time later, we'll address it just because, yeah, I'm looking at some of these and probably um, the website will be able to help you out with that. Or like emailing future.md@ualberta.ca, like they'll give you the official answer. Let's see. How do Are AP courses worth taking in high school? That I took IB and was it worth it? I think it was because I like the teachers and I like my classmates. And yeah, if you get like a high enough score during the exam, then or like in the IB course, then you can take university credit, which is great. So in that case, it's worth it. Otherwise, like I know some very smart people that just didn't take AP or IB. I know one guy, he's like in Australia. I think he got like a full ride scholarship to med school there. Super smart guy. And I don't think he did IB courses or AP courses. Congrats on your first year as a medical student. Thank you. It took me 3 tries, so it's a long time coming. How's the experience been for you so far? So far, it's been pretty good. I will say that my undergrad was at the U of A, and I feel like because there's so many people in the Faculty of Science, and you may experience this in other big faculties, it feels like Like no one's really close with each other just because, you're in classrooms of like 400 people and you don't really get to know your profs very well. There's not that much small group work. So I think that's pretty nice. It's very relevant. It's pretty fun and like yeah, even when class is boring, like you're all in it together. So I do enjoy that. What's something you did not know until later in your learning experience? Oh, here's one. So med school, first day. How much time do we have? We still have time. First day of med school. I'm obviously excited. Everyone's excited. I haven't been in school in 3 years because I graduated and then I started working. So I was out of school for a bit. First day of school, everything's great. We're all like getting backpacks and taking pictures. And then we just sat down in the lecture hall, and then it like hit me that this is still school. And you have like assessments and tests and quizzes and assignments. So it's like, I think it's kind of idolized, but then once you sit down, it's like, it's still school. And being a doctor is still a job. So, you know, not to burst anyone's bubble, but definitely keep that in mind. It's still school. It's not just like you get in and then you can just like party all the time. You still have to work for it. Uh, let's see. What aspect of your program would you say is the most challenging? So what aspect of medicine is the most challenging? I think it goes by so fast that you can like you'll miss things. And I have FOMO, so it really sucks. I will say like yeah, like some people are just doing a million things and it's hard to like realize that you're on different paths even though you're both in medicine. Their interests may take them to a different road, so it's kind of hard to like not compare yourself. I know they say in medicine like once you're in you shouldn't compare yourself, but I have friends that are like they've shadowed 10 different surgeons already, or they're already doing a bunch of research projects. But I rather do stuff like this and I don't feel bad about it, so that's one thing that's challenging. Let's see what else. What are some other majors that students have? So what are some other programs that med students have done? I will say there's one person in our class that has like 3 doctorates already. Sorry, 2 other doctorates. So they're like super, they love school. As I said before, quite a few nurses, physiotherapists, a dentist, switching over to some less arts, or sorry, less health science, a few engineers, computing science. Um, Now, despite all this diversity I'm saying, I will admit, like a lot of them are in some sort of science uh, major. So physiology, biochemistry, neuroscience. And a lot of them did do master's degrees in some sort of research into like health sciences, biology. Let's see what else. What color was your backpack? So every year, med students get a backpack. And I didn't actually realize this was a huge deal until like a week before. So every year there's a backpack with a different color. So in 2020, it was yellow, and then it switched to orange, and then it switched to blue, and then our year is gray, which I thought was a bad color because it's so boring, but you can blend in really well. So I like the gray backpack. I don't know what next year's will be. Any tips for the extracurricular portion of the application? What would be some good things to have on there? Is being part of research a big deal? I'll answer that backwards. Do you need research? No, you don't, because there's no requirement. Although, if you look at research, you can get a good reference letter, you get some publications, um, you establish good rapport with an academic staff. So you can see that there's actually a lot of advantages to doing some research. And I usually encourage, if you're a science student, even if you're in general science, I'd probably do at least a little bit of research as part of your degree. I gotta be honest, I hate research, but I still did it because that's kind of what a science degree is meant for, is for you to be a scientific thinker. So is it a big deal? I want to say no, but you can see there are some advantages. What would be some good things to have on there? Just like I would say diversity, doing things that you like. I think someone told me like your applications kind of, it should be a reflection of who you are. So if you like something, I would put that on it. I think I put Overwatch in my application actually for life experiences. I put that I reached masters because I really like Overwatch. So there you go. What did you use your undergrad degree for work life experience? So what did I do with my undergrad degree? I worked at the library. I worked at EPL because to be a library assistant, you just need an undergrad degree. So definitely think about it in terms of it may take you 3 to 5 tries to get into med school. So the degree you get better be something that you can use. It can't just be a dead end thing. Um, yeah, try and find some sort of backup plan because a lot of people end up having to do backup plans. There's someone in my class, he's a pharmacist, practiced pharmacy for like 5 years. So like he had his backup plan. So you should have one too. Let's see, do you have any tips, advice for the MCAT prep courses or materials? The two main ones are Princeton Review and Kaplan. And those ones you just get like 5 books. It's like a package. And yeah, it's kind of like a textbook style. I think those are good if you have a background in those subjects. If you have like absolutely zero background, you could consider like a prep course. They usually cost a few $1,000s, which is a different discussion. I don't like how they charge thousands of dollars, but you could take a prep course. And maybe I would suggest that if you have like zero science background, like you didn't take any science courses at all. But otherwise, yeah, Kaplan or Princeton Review, you can just buy the books. You can buy it used for like, I don't know, like 80, $100. And brand new, I'm not sure how much they cost anymore. And again, I'm gonna skip over the academic requirements one because you can email MD or you can check the website. Do you ever think about going into a master's after your first cycle? Oh, I did. Yes. So a lot of people, what they'll do is they will, if they don't get in the first try, they'll do a master's degree. I'm 99% sure I read somewhere that you can get like extra points. Oh, I can't remember if it was for a PhD or a master's or both, but um, clearly a lot of people do a master's degree. I think at least half my class either had one or was in the middle of one. So I did think about it, but I don't like research. And I was like, you know what? I'd rather help people with books and sing to kids and help seniors set up Facebook accounts because I think that's more fun. So again, have control of your life. Don't make your life uh, completely focused around medicine. Uh, would you, someone asked, would you be able to use an undergraduate degree in biochemistry for job positioning? This is like life advice. Probably a lot of jobs just require like an undergrad degree as the requirement. So you can work at the library, they'll take you. And I'm sure there's other ones too. I'm sure like maybe like a lab tech position you could probably do if you have lab experience. Um, Otherwise, you could always do a master's in biochemistry as well. Next question. I think we still have time. What is it? 5:52. Yeah, we still have time. What's the best undergrad degree for med school in the Faculty of Science? Biochem or biochem? In my opinion, the most relevant one is probably physiology because you're just learning about body systems. And in medicine, you have to learn the body systems. But at the same time, again, I don't think that knowledge makes you a good physician. I think being personable and having good communication is probably more important. But if you had to choose something that was very relevant, I'd probably say physiology is your closest one. Someone asked what the med interviews are like. So they're MMI style. Yeah, I guess my presentation didn't really talk about exactly what it is. It's online. It's called MMI, multiple mini interviews. So it's like different stations. I think there's usually like 8 stations, 7 stations. In each station, there'll be a question posted for you to read. You'll have like a few minutes to read it, and then you have a few minutes to respond. So it could be anything like you're deserted on an island. What would you take and why? So kind of more philosophical. Some might be more situational, like, you know, I don't know, someone comes knocking on your door at night and they're cold and hungry. What do you do? So it's kind of like the Casper. It's like situational judgment stuff. And they usually ask one panel style interview. So they'll be like, why do you want to do medicine? What makes a good physician type thing. So that is the interview. It goes pretty fast. I think it took me like an hour and a half to go through. So, which actually sounds like a long time. But because it's broken into little stations, it like it goes super fast. Uh, how do you feel in terms of FOMO with your friends who aren't in medicine, moving on with life? Yeah, definitely. I would say 24 to 25 is the point where you will start to diverge from your friends because some friends will get married and have a house and like think about a mortgage and think about kids. I didn't really have FOMO from that. I had more FOMO from people who are getting into med, I think. Um, I'm not too worried about uh, people moving on faster. Honestly, their lives would seem pretty stressful. So I was kind of happy being back in school. There's a different level of stress when you're a full adult. What do you do if you don't get into your dream university? If you're talking about medicine, you take what you can get. Because I applied to 10 schools and only U of A offered an interview and only U of A offered a spot. So actually, a lot of times people get into a university that that wasn't maybe their first choice, but like you take what you can get. But U of A was my first choice. Did Overwatch or other games help you with typing speed on the Casper? So does gaming help you with the Casper? Well, no, because I'm really bad at typing. I don't know how to type properly, and I play console, so no. And I'm pretty sure the Casper, when I did it, half of it was video, literally like an interview, and then the other half was typing. I don't know what it's going to be like in future cycles. It might just all be video responses. Um, but yes, is typing speed important? It kind of is, because obviously if you can only type one sentence, right, then you're probably not going to get a high score. So typing speed isn't everything, but like you should be able to type at least average speed, I would say. Someone asked, do Anki notes help? I don't know if that's in terms of undergrad or the MCAT or medicine, but regardless, I don't like Anki, but a lot of my friends use it. If you don't know what Anki is or Anki, it's like a flashcard software that you can download. Um, I don't like it, but some people use it. I think we got. Oh yeah, go ahead, Vincent.
No worries. Well, thank you so much, everyone. We are running out of time, unfortunately. I am noticing the trend in a lot of the questions being asked. These are questions, things such as what about IB transfer credits, things like that. These are issues that you can ask about from the national recruitment team. So you would be able to email the undergraduate offices of your interest. So whether it be faculty science, arts, education, business, anything else like that, feel free to email them. If you're asking about more specific requirements in terms of the MD admission that we were discussing previously, please feel free to email MD admissions at ualberta.ca that I did toss in the chat earlier. I'll be dropping it again here. Give me one moment. As they'll be able to give you more in-depth information that will be useful for you. In terms of things such as future notes, please feel free to email the future.md@ualberta.ca, the MD admissions. Check out the med@ualberta.ca website that Jason was talking about. And yes, thank you so much. Thank you all for coming by. Jason, thank you so much for discussing and talking about your experience. I'm sure everyone that did attend very much enjoyed it and was very grateful for it. And for everyone else, please take care. Have a wonderful evening and hope to see you on campus soon. Goodbye.
You guys, thank you for coming.